South Bay Vascular Center and Vein Institute is a practice that I founded about 15 years ago here in San Jose. Originally we were actually in Los Gatos, now we're in Campbell, and is a practice that deals with patients who have all kinds of vascular problems, both arterial and venous. We've focused over the last 6 years mostly on venous problems because it seems that there are a lot of patients out there who were not getting all the options presented to them in terms of what possibilities there were for the treatment of their vein disease, and there really wasn't any other practice in the area that offered all of the options. It's really important for us that the patients can know that we can do whatever is the right treatment for them, as opposed to just doing the treatment that we offer for every single patient. And it's important also that we can manage patients who have both arterial and venous disease, know when not to deal with the vein problem of the patient because of the potential for an issue with an arterial problem at a later point or at the present time, and that we can offer not only the therapeutic but the diagnostic treatment options for all of these patients. South Bay Vascular Center and Vein Institute developed initially as a general vascular surgery practice. And as some of the newer techniques happened in the treatment of venous disorders and allowed them to be moved from the hospital into the office, it was important that they be done by a vascular surgeon and someone who had the ability to do both office procedures and hospital procedures, someone who could do all the options, who could perform all of the options available for any given patient. And that wasn't available at the time, and still isn't available anywhere outside of here. Most of the vascular surgeons in the area really have very little interest in venous disease and focus on arterial disease and dialysis access, and I think that's a very important thing, but I also think that there was a large subset of patients who didn't know where to go or didn't have a good option for someone who had actually been fellowship trained to deal with venous disorders in this area, and so that's how we started here.